Good afternoon,
Lynette,
everyone. Yes?
Yep, go ahead.
Can you hear
I
me?
hear you.
Okay.
Great. Good. Yes, go ahead.
Thank you all for joining us this afternoon. It's July 18th, and this is our Food Insecurity Domain kickoff. So we're excited to have you all on the line and really start getting to work on these data elements that we have talked about for so long. Next slide, please. Just some administrative items to go through. You've seen this a million times, but if you want to back up a slide, Evelyn, sorry. Something's happening. All right, there we go. We do record these calls, and we will post this recording on the Gravity Confluence Wiki, as well as the meeting materials following the meeting. And you all come in on mute because we do record these calls, but if you would like to submit questions or comments while we are presenting, and we will take a pause probably at least twice to take questions and comments verbally. But if you would like to do that in the interim, please do use the chat feature and send it to everyone, because that way my entire team can monitor, and others of you who are in the community can also address questions. And we did that last time. It was very exciting and very helpful. And if you have any technical difficulties or questions, you can reach out to me directly at Lynette.Elliott, 2 L's and 2 T's, at emiadvisors.net. Next slide, please. And if you can all turn off your video, I would appreciate it. For Gravity project participation, we do ask that if you have not already done so, to please join the project as a registered member, because that's the distribution list that we use to send out follow-up emails and to send out information that is pertinent to the project. And you can sign up as an other interested party or as a committed member, and we welcome all levels of participation from both sides and in between. And you can change it at any time if you want to. If you need to check your membership status, you can also go to that join page and scroll down to see the list of members. And then that third bullet is our home page that you can land on for all things Gravity Project. Next slide, please. I believe that either Laura or Caroline are going to introduce our food insecurity leads if one of you ladies wants to take over from here.
Hi, Lynette. It's Evelyn. I think I'm having trouble knowing which call-in user Caroline is. I'm just going to try something quickly. Caroline, can you speak for a second? See if I can unmute you.
And Caroline, you may be able to press star 66 on your device. That may make the magic unmute happen.
I've unmuted all the call-in users just for now because I don't know which one she is. Oh, there she is. All right. Caroline, can you speak now?
Yes, I can. I'm so sorry about that. Hi, everybody. This is Caroline Fichtenberg from Siren, and I have the pleasure of introducing the two women who have been working behind the scenes for the past couple of months, really hard to get the project moving in terms of food insecurity work. And they are Sarah DeSilvi, who is a family nurse practitioner in Vermont and has been doing a lot of work with Children's Health Watch, the Food Research and Action Center, and Siren on medical and social care integration and interoperability, particularly around food insecurity. She has been working with Donna Pertel, who's a registered dietitian nutritionist and the editor of the Academy of Nutrition and Dietetics Nutrition Care Process Terminology Reference Manual, Dietetics Language for Nutrition Care. The two of them are going to be helping to launch our work delving into food insecurity codes. So we're really excited to be at this stage in the project and very, very thankful for the work that they've been doing helping with this. I'll turn it back over now to Evelyn.
Thank you, Caroline, and good afternoon, everyone. So I'm excited to introduce the EMI team who's been working hand in hand with Sarah and Donna on the food insecurity data set. So want to take an opportunity to introduce Linda Hyde, who many have not have heard her voice previously, but you will hear her voice often moving forward. And of course, those that have been meeting with us previously have heard Lisa Nelson, who has also been working on, educating us on data element and how to submit, and has been pivotal in helping us establish our data element submission and adjudication process. So just quickly, a few notes on Linda. So Linda is a clinical coding and terminology expert who supports various projects related to electronic data collection for performance measurement and other initiatives. As a terminology analyst for these projects, she regularly works with various classification and terminology systems, including ICD-10, CPT, HCPCS, LOINC, SNOMED CT, and RxNorm. She has extensive knowledge of data standards and data quality and regularly speaks and publishes on these topics. Linda has served as chair and member of the AHIMA Classification and Terminology and the Quality Measurement and Secondary Data Use Practice Councils, as well as a member of the NQF Expert Panel on Coding Maintenance. She is currently a member of the AHIMA Advocacy and Policy Practice Council and an AHIMA certified ICD-10, CM, and PCS trainer. And also want to acknowledge that it is Linda's voice that you see. We currently have recordings of the code systems on our conference as we have education material. It is Linda who helped put those together and record the sessions. And those, again, as I mentioned, who have joined at previous meetings would have heard Lisa Nelson's voice. As a reminder, Lisa serves as a value sets lead for the Gravity Project. She has over 20 years of experience in the development and use of health IT standards. Her work with health IT implementers, payers, medical societies, public health organizations, and government agencies. She works with them to support their needs for standards-based data exchange. This gives her a broad exposure to today's most relevant use cases for interoperability. She is passionate about accelerating improvement in the way health IT standards are developed and deployed. She also is a strong advocate for the inclusion of consumers in the health IT data sharing ecosystem. So we're excited to welcome them both. And with that, I'm going to jump over to our agenda for today. So for today, we've already gone through welcome and introductions, and I'm going to hand it over to Sarah to talk through background on food insecurity, why we are looking at food insecurity, and then she'll hand over to Linda, who will go through our approach to date, as well as give you all a glimpse of all the work that they've been working on behind the scenes on existing data element submissions and how we'll move forward. So she'll show you how elements have been adjudicated and give you a glimpse of the master list. This would be followed by Lynette, who's going to have a new announcement. We've got changes to our upcoming schedule, so Lynette will walk through that. With that, I'm happy to hand over to Sarah.
Hi, can you guys hear me?
Yes.
All right. So again, my name is Sarah DeSilvia, and it's my sincere honor to do the kickoff representing our background crew that has been working for the last 2 months on food insecurity master submission list and the food insecurity domain approach. I'm going to first just go into a recap of the work of the Gravity Project in general. I'm going to just remind everybody that the intent is to focus on 3 major concepts: food insecurity, housing instability and inadequate housing or housing quality, and transportation access. And then there's 3 basic intents within that grand scope. First, to develop use cases for support to support social risk documentation across screening, diagnosis, planning, and treatment activities within electronic health record and related systems. We worked really hard on that, and the use case is evidence of that. The next bit is to identify common data elements and their associated value sets to support the use cases, and this is where we are now. And then to develop a consensus-based set of recommendations on how best to capture and group these data elements for interoperable electronic exchange and aggregation. Next slide. We just decided to ground the food insecurity domain kickoff with some very brief orientation to the definitions of food insecurity. At first, we're just going to group the common definition according to the United States Department of Agriculture is that food insecurity is an economic and social condition of limited or uncertain access to adequate food for an active, healthy life. It's important to note that the food security status of each household lies along a continuum from high food security to very low food security. Lack of access in all cases is due to a lack of monetary resources or the inability to afford adequate food. We also want to take a moment to revisit how the spectrum of food security corresponds to food insecurity status. You can see on this graphic, which borrows from the work of the USDA Economic Research Service, that within food security on the right, there's both high food security and marginal food security. Marginal food security is a condition of decreased food access or worry without a clear effect on quality, variety, or quantity. However, it is still a health concern as noted in the literature. On the other side of the spectrum lies food insecurity, the topic of the day, a condition where there is an effect on food quality, variety, and quantity. Next slide, please. We wanted to briefly discuss some of the literature that grounds this work, including a very, very brief overview of some of the associated concerns of food insecurity. These include increased rates of the CDC diseases of concern, increased child developmental risk, poor self and caregiver reported health for all ages, increased rates of depression and psychological distress, increased ED visits and hospitalization, and increased total cost of care. We included a graphic from Children's Health Watch's and Greater Boston Food Bank's Massachusetts Cost of Hunger study, which is a really amazing detailing in the total cost of care for one state in New England. Next slide, please. So the food security status of the families we serve matters. This is clear. So what if it's hidden from our documentation, our referrals, our orders, our risk analysis, our research, and our care? And this is what grounds the Gravity Project. Next slide, please. So given that the end goal is conceptually and practically aligned standardized data, we want to take a moment to offer perspective on the considerations we apply in the adjudication process as submissions come in. So I'm going to go through each of the activities in turn and just give a general approach. So when it comes to screening tools, what we're looking for is consistent questions with discrete and uniform answers to enable standardized data. Within an alignment framework, we're looking for a conceptual map with the core concepts of food insecurity. Within the diagnosis activity, we're looking for clear definitions and terminology that can, again, enable standardized data. And we're looking for alignment to the principal and secondary associated diagnoses. If you're submitting secondary or associated diagnoses, we do ask that you attach evidence to support that submission. You will see that demonstrated in the American Academy of Nutrition and Dietetics submission on the master spreadsheet. Within goals, we are, again, looking for clear definitions and terminology to enable standardized data. We're also looking for consistent variables and a capacity for measurement. And you can see this in the evolution of our own goals on the master list again. And we're looking for a conceptual map with the core concepts. Within interventions, once again, clear definitions and terminology to enable standardized data. And alignment here is really alignment to process, what we do across our various settings and roles. Next slide, please. I'm honored to give a moment here to present here on how the definitions work of the Academy of Nutrition and Dietetics is a bedrock for this project. As the largest association of nutrition and dietetics practitioners, the Academy of Nutrition and Dietetics is involved in the Gravity Project and has submitted content to support efforts to document food insecurity. This is my amazing colleagues at Donna Pertel, principally, and Konstantina Papakis, who's on the call as well. The content is based on the Academy's Nutrition Care Process, or NCP, which is a systematic problem-solving framework that nutrition and dietetics professionals use for nutrition care and research, promotion of critical thinking, focused nutrition care documentation, and improved application of evidence-based nutrition guidelines. The NCP terminology is a standardized terminology or controlled vocabulary that complements the nutrition care process and includes documentation for individuals and populations. Each year, there are Academy staff and 70-plus members in the Academy's nutrition care process and research outcomes committee and work groups with U.S. and international reach that are involved in development and maintenance of the nutrition care process terminology. The food insecurity content that has been submitted for consideration by the Gravity Project and its community includes nutrition diagnoses and nutrition intervention terms that are encoded in SNOMED CT. And that's that.
Thank you, Sarah. So with that, let's open it up to questions before we hand over to Linda. We do have one question already in the queue from Jennifer Ramona, so I'll repeat. Her question is, should food security also include functional conditions that limit access? For example, someone may have financial resources and interest in eating well, but can't physically go get healthy options, or even may have them in their home, but cannot tolerate the exertion to fix a healthy meal.
Donna, do you or I want to dive in there? Is Donna unmuted?
I think I'm unmuted now.
Oh, hi, Donna.
No.
I guess I want to give a quick. That is absolutely a condition of concern, but it's not linked to the conceptual map of food insecurity. However, I do want to give a nod here. This is why I had Donna unmute herself to the AND's approach to those kinds of concerns when it comes to nutrition.
Yes, I think clearly this is a concern, but I don't think that it does fit this conceptually, because in this instance, the individual does have financial means to access the appropriate foods. But these are certainly issues that dietitians and other professionals deal with regularly as they assist individuals with this kind of scenario.
Thank you, Donna and Sarah. And let me I can unmute participants for a section unless, let me double check here. If those do want to speak, put in a chat. Any other additional questions? No? Okay. Well, and I'm running. I'm running audio today. So, here it is, Elaine. Does this also include considerations where individuals don't have access to a variety of foods due to food allergies?
That is a concern, but not a match to the concept of food insecurity as defined for this project or in the literature.
Great, thank you. All right, so one more from Alyssa. There may be times where a provider provides a treatment for a patient who is at risk of food insecurity. For this project, should we consider those examples? I think that is something that deserves submission and review. If you're meaning at risk, because I think that's why we included the spectrum to just recognize how subtle the spectrum is and how quickly people can fall from food insecurity or food security into food insecurity, and also to mention how marginal food security, which is just worry, carries its own burden of risk. And we did include marginal food security on our master spreadsheet. So I would say yes. Thank you, Sarah. 2 more questions. Unless, Donna, anything else you want to add?
No, but I'm ready to jump in on the next questions that appear.
Okay, so the next question is the concept of malnutrition considered. Perfect.
And I'm so glad that Alyssa raised this. The Academy of Nutrition and Dietetics has proposed that the concept of malnutrition be added as a potential diagnosis. So we'll look forward to the community's feedback about that, and are hopeful that our terminology could potentially be included in this project.
One more question. Apologies if I missed this. Has there been any effort to identify people who can afford food but not quality healthy food? Oh, yes. So Lisa responded already. Okay. All right. So with that, I'll continue monitoring the chat. And so with that, I'm going to now jump over to Linda. Linda, want to double check that you can speak?
Yes. Can everybody hear me?
Yep, I can hear you.
Okay, great. Thank you, Evelyn. Yes, I'm Linda Hyde, and I'm going to be taking us through this next section of today's session. For those of you that were on last week's meeting, you would probably recognize this slide as Lisa took us through the process, describing how the entire data collection process would work, and then focusing on how you submit data for consideration in the various areas that Sarah had gone over. So really the focus here is getting everybody's input in terms of what they're currently using for screening, diagnoses, interventions, and goals related to food insecurity. And that's what our submission process is. We went through the online submission process last week, which is an enhanced version of the Excel spreadsheet that we had previously sent out. And we also talked a little bit about that adjudication process, and that's where Sarah and Donna come in as our subject matter experts to help us review these submissions and determine what moves forward and how it moves forward. And we'll show a little bit more about that in a minute. The final thing is that as we build this master file that we've referred to a couple of times already, the goal is at the end of this submission process to have a very robust list of concepts and terms in these various areas that we want to present to the entire community to provide a approval process to see which ones are we all comfortable with that we want to keep on our list as being representative of the food security domain. I also want to make a point, too, that this is a work in progress. So after last week, we did make a few minor changes to the online submission tool. I don't know if anybody's actually used it yet. But what we do want to do is, as Sarah had mentioned earlier, we have various points in which we would like you to provide reference information, either files or links to URLs that support the material that you're submitting on the submission form. So in these areas, if you have multiple URLs or multiple documents that you want to submit, you can only submit, you can only do one submission or attachment, but if you put multiple URLs in a single document, or if you zip a series of multiple articles, you can upload that single file to us, and then we will be able to extract that and use that. Next slide, please. I think Lisa also mentioned the adjudication process last week, so I just want to go over what areas we're going to be looking at as we look at the submissions. As we build this file, we definitely will be encountering people who are submitting items that are duplicates of ones that are already on the list. And so as long as we will acknowledge that, and I'll show you when we do the master file review, how we will identify and count the number of organizations who are actually submitting or using the same data element. We may also we'll find more new data elements that fit the scope of our domain here, and they're either not too broad or not too narrow, and we will be adding those to the master list. In some instances, we will make a decision not to add a submission. One way we would not add it is if we look at it, it's not in the scope of food insecurity in this domain, but it may be useful in the future in one of the other domains, or as we move forward. We will park that item so we don't lose track of it, but won't go on the master list. And in some instances, if we get submissions where they're not in our scope at all and not in any other domain that we may be interested in monitoring, we will not add that. What we will do for everybody is, as we review your submissions, we will have a final list of the disposition of all the items that you submitted to us, so that you can see exactly what happened to them. The other status is sometime we may need more information. We may need a clarification. We'll put it on a hold status, and we will go back to the submitter and ask for clarification. And at any time, obviously, as we publish this master list or as we get back to the individual submitters with our dispositions, we can reconsider something if you feel strongly that you believe it should be part of our master list. So next slide, please. And what we wanted to show today is that we've actually already gotten some submissions. These have all been through the Excel file that we provided several weeks ago, but we're glad that we're starting to build up a file of submissions to review. You'll see Sarah and Donna's name on the first row. We built the current master list off of their initial submissions, and we actually asked them to go back after we did that and go through the same adjudication process that we will be doing with all of the subsequent submissions, so that we now have a master list that they both feel comfortable with, belong in those particular areas. And we're just, for a sense of volume, we're giving some information about how many different screening tools, how many specific questions were submitted, diagnoses, goals, and interventions. What we will be doing now is we'll be going through the rest of the submissions and following that same adjudication process. And each time we will update the master list, we will be publishing that master list. Lynette will go through the schedule of that at the end of this particular section here. But we wanted to just let you know that for those of you who submitted something early on, we haven't lost it, we haven't forgotten it, and it will be our first priority as we go through the adjudication process. Okay, next slide. All right, this is the point in time where Evelyn's going to hand me control so I can actually demo our current master list as it exists now in our system. Okay, and let's see.
You have presenter right. Do you see the ball, Linda?
Yes, and I want to just make sure I believe this is the file.
I know we had a few questions come in while you were speaking, Linda, and I do see Lisa has responded to a few. As you bring that up, Lisa, is there anything you want to share with the community?
I didn't share the right thing here.
Sure. Am I unmuted, Evelyn?
Yep, I can hear you. Go ahead.
Excellent. Super. So Corey had put out a good question just to understand how do we figure out if data elements are too broad, too narrow, fit for purpose. And this is a human process that our very experienced subject matter leads are helping us with. So the process is to use their background and information as well as kind of a group challenge process. So we meet 2 or 3 times a week to discuss row by row what we're thinking, trying to make sure that we apply consistent reasoning about this. And then for each submission file, there is an adjudication row that comes back where you can observe the comments that were added that give you a clue as to what the subject matter experts were thinking, what they considered, as well as what their decision was around too broad, too narrow, or obviously duplicate or added or just not fit for purpose.
Thank you,
Evelyn,
Lisa.
this is Lynette. There were a couple of other questions as well. Rachel Barron Van Cleve was asking, has there been any effort to identify people who can afford food but not quality or healthy food?
So I would say that question is for Donna and Sarah.
I think, this is Sarah, I think we answered that one earlier, but we did not answer the one about having difficulty with access, right? So we said the having money, well, I'm not quite sure, but I don't know. What I would say is that having difficulty accessing food is more related to a food desert concept and less about functional limitations, and it ties into the previous question. Donna, do you have any thoughts there?
I would agree with your assessment of that. It certainly is a concern when we have someone who has access but not the right kind of access, but it would need to be further elucidated if the individual has insufficient funds to meet the definition of food insecurity. And then if that's the case, then they of course would fit here. If they do not, then they do not.
Thanks, ladies. And this is Lynette again. Alyssa Wasong also had a question, and forgive me if you addressed this in some of your previous comments. She's asking, is the concept of malnutrition considered?
Yes, we've included it in the diagnoses tab, so we'll be curious about the feedback from the community on that one. Thank you.
Thanks, Donna.
Any additional questions? I do see Matt Bishop just put a last one. Did you ask that one? Have we addressed it?
I'd be happy
I think that one's new.
Yeah, I'd be happy to address this. This is Donna. So there are actually, in terms of interventions, there are interventions related to motivation that have been offered by the Academy of Nutrition and Dietetics. In terms of diagnosis, that was not a consideration by the Academy, but perhaps that is a concept that should be put forward. That's a good point. I appreciate this feedback, Matt. Thank you.
Okay, we have one more question from Jane Persig, and then we'll have Linda present. So the last question, will we be able to transfer the concept of lack of funds for food to housing when we get there? And I know you, Linda, you had talked about this being a park, items where we could park and see if they're relevant to the other domain.
Yes.
Okay. All right, so with that, let's hand it over to you, Linda. We see the Excel file.
Good. Took me a while because I guess I had one too many files open. I couldn't find the right one. So you got to see a lot of other things on my screen for a few minutes. But anyway, this is our master file. And it's set up in sections. It'll look very similar to the submission files in terms of the columns that you'll see for the most part. But I want to just walk you through each one of these and just kind of show you a little bit. For example, we're on the screening question and answer page right now. So you can see here we already have, thanks to Sarah and Donna, we've already populated this with a number of screening tools. So we will identify the tool. If the current tool that's being submitted has already been set up in LOINC with LOINC codes for the tool itself and for the questions and answers, and you can provide us those codes. If you don't know them, we will look them up. That's one of my jobs, is to check the various terminologies to see if things that have been submitted that may not have a code attached actually do have one already existing in the various systems. But here you can see we have hunger vital signs, which does have a setup in LOINC. So we have the LOINC information, we have the question, the LOINC question code, we have the question name that's in LOINC, and then we have the answers. So again, for each answers, there's going to be a LOINC answer code, and in some cases for responses, there may be existing SNOMED code. Not all the time. But if there is one, we will look for it. And then here is the column where your reference information, if you're sending us a PDF or a link to a URL, or if I said you have multiples and you send it to us as a single file, we will expand that information here so that we can capture that screening information. And as you can see, there are some other screening tools down here that don't have LOINC codes yet. But again, those are part of our project when we're done and we all come to consensus on these are what's represented in that final master list are appropriate screening tools and questions that we want to use going forward. Then the next step at some point in the process would be to request that those be assigned codes in LOINC. On the diagnosis and assessed needs screen, here we will see some of the diagnoses that have been, again, submitted through Sarah and Donna. Here we are looking if they exist in SNOMED, and a lot of the ones from the Academy have already been established in SNOMED, which is why we have these codes here. We will be able to identify those and put them on the list. One other thing you'll notice is that in this left column on all of the tabs, we have an ID. That way we have a link to a unique code or a unique concept or term so that if we need to reference something, especially if we find a similar or a submission that's very similar in terms, could be a synonym for a existing concept, we'll be able to link those so we can see this is what we think this means for you. That will end up being on the adjudicated file if we do see that you will see back as a submitter. The other thing we had talked about was diagnosis type. This one isn't populated yet. There's still a little work we have to do, but this is identifying whether something is a primary versus a secondary or associated diagnosis as it relates to food insecurity. Again, here you'll see here if there may also be ICD-10 codes that match our code for that similar concept. If there is a code out there for ICD-10 that's consistent, then we will add those. We do have a few that are actually new codes that are being proposed for not this coming fiscal year, but the following one, which is why they're highlighted in blue. And that's just to remind us, yes, there's going to be a split to more unique terms in ICD-10 for food insecurity from what code exists today. And again, you'll see all the reference information. These are the ones, as Sarah mentioned, these are the ones that Donna had added that identify the reference for these diagnoses or needs that have been established here. On the Goals tab, again, very similar. We have goals. We now have 4 goals. We have references for them, and we will be, as I indicated here, we have unique IDs for those. And here we will be looking to see if any of these have anything established in LOINC, but at this point in time they don't. One other thing I want to mention here is if you do end up submitting a term that already exists on our list, what we are going to do is we're going to add your organization to our master introduced by key here, and we are going to increment the count of organizations so we can see at a glance whenever we publish the master list how many organizations are actually using one or more of these concepts or terms from the various sections. And then we finally have interventions planned and completed. And this is probably one of the areas where we will see a lot more of submissions for people based on the various ways in which they label or describe the interventions that they perform. We do have a major intervention type just for organizational purposes. Is it a case or care management type of intervention, counseling? You'll see others here, education, and you'll see provision orders, referral. So that's just kind of a categorization level. Again, based on what Donna and Sarah have submitted to us, we have interventions that have already gotten or have codes assigned in SNOMED. In some instances, we have CPT codes that are available for certain types of interventions, and in one case here, we also have a HCPCS code. You'll also see here towards the end, we have the same reference information, so as you submit interventions to us, we will be able to and any supporting documentation will be able to attach that to these concepts. And that is a brief overview of the master file. And I believe at this
person is that falls in that's like when there's like math that it could be done. Like
questions, we turn it back over to Lynette.
Hi, no, thank you. We want to open it up for questions, so I will be unmuting all. So I think I did that too early. I'm going to unmute you all, so if you do have questions, you can directly ask them or include them in the chat. Let me see if I can do this without creating another hiccup. All right, so let me see who is, all right, so. Sorry, all right, so if you're not speaking, I've unmuted most of you all so that you can ask your question directly. I think here's the opportunity for you to, let me see, who is, I'm going through the list to unmute people, to mute people who are not muted. Okay, so if you do have a question, I've unmuted everyone, so please keep yourselves on mute if you're not speaking so that other folks that do want to bring up their questions can. Oh, lots of noise. Oh, boy. Does anyone have any questions? And if you're not speaking, I'm just scrolling down. I cannot see who is seeing the noise. Oh, here we go. That one. Okay, that's better.
I have a general question. Yes. I was trying to find the first thing, these link codes look super useful, and but I haven't been able to find them in my EMR easily. And I was wondering if people have been successful at finding link codes in their EMRs and been able to pull them. In particular, self-determinant link codes, not labs. And I'd like to hear some success stories on that because these data look very useful.
Thank you. So that question is from Dawn. I think you had also posted it here.
Yeah.
All right. So are there any respondents that have been able to find this in their EMRs or EHRs?
So this is Sarah. I can say a brief statement to that end. I think I helped work with Children's Health Watch to build the link for the Hunger Vital Sign, and then Prepare just got built into the link as well, which is great. What I'm going to say is I think it's not there until we ask it to be there as users. I think there's what I noticed through my quality work. Very few of the panels that are able to be included in link are, including like depression screening at the PHQ-9 or ACEs screening. So the capacity is there as long as it's in the panel set, and we just need to make it so.
Okay, well, that's fair enough. All right, so it takes some action on our end to make it happen.
Yes. No, John, this is Evelyn, and I know we have a few EHR vendors on the call, and I've heard from a few of them that they can make the codes available, but I think one of the challenges we've heard over again is they don't know which codes to make available, which ones to use to represent specific concepts. So I think that's why this project has been very interesting to them, because they would like to have an understanding of what's being used or what would be the best standard or code to represent the concept.
Okay.
Any other EHR or implementers on the call that want to chime in?
I guess it's not possible, and I would say that.
We can't hear you.
Can you hear me a little better?
You're still very faint. Can you speak into the microphone?
Sure. How's that? Is that better?
Yes.
Good. So I would say that in terms of LOINC, because it requires very specific wording in the questions and answer sets, I mean, we're still working to be able to customize and allow for the lack of standardization in the questions that are being asked and the way they're being asked. And LOINC in particular, I don't know how flexible it is to that for the variety of different screeners and questions that people are asking. We've got a little bit more luck with the Z codes, ICD plan, in getting those concepts in.
Okay, thank you. So I could hear some of it was a little blurry for me, and I don't know if it's my own audio, but I think what you're saying is that there are LOINC, so if I'm interpreting, there are some LOINC codes available. It's just figuring out which ones to use to represent certain concepts.
Can I echo one thing that I heard in his statement as well? This is Sarah. I think part of this, though, is that what we tried to do in that slide, which is an introductory slide, is that there is, as long as the tool is consistent, and again, it can get confused with terms, but if it's standardized according to measurement, like has consistent questions and consistent answers, even if it's not validated, and even if we were talking about the San Diego tool in our work, it can be built into LOINC as long as we ask it to be, right? So this is part of the purchase of this project. So if you have a tool that is consistently used with consistent questions and consistent answers, please submit it. And so we can see if we can get that encoded so you can start using it and sharing it to other people in your region and developing common data.
Thank you, Sarah. I do see we had a question from Rachel Barron Van Cleve that Lisa was answering. So Rachel's question was, can you say a bit more about the purpose of the goals tab? Lisa has responded that goals are used to assess if interventions are making progress toward the goal. We need goals to measure if progress or improvement is being attained. We can measure things in terms of outcomes if we have goals. And of course, goals need code, right? Anything else, Lisa, you want to add? Or Rachel, does that help answer your question? Let me make sure I can unmute Rachel. Anything else to add?
Yeah, I'm just trying to picture how this fits in the clinician's experience too. Will the goal be appearing in the electronic health record, or how do the goals ultimately get used?
So this is Evelyn. I can answer something about the goals. So we do know goals are part of the there is a regulatory requirement that electronic health records that are certified have the capability to document goals. So it's part of what we call the U.S. Core for Data Interoperability. So there is that, and we've seen it across a lot of the vendor systems, that they have that capability to document goals in a structured way, standard way. So that field should be available in a certified EHR.
And Rachel, this is Lisa. I will say this is one of the new areas that's evolving, but it is both on the CCDA and the FHIR side of things, and we are seeing EHR vendors beginning to support this. And the semantics for goal observations permits identifying if it's like a clinician's goal or a patient's goal or a shared goal. And earlier somebody asked a question about indicating notions of motivation and intent by the patient to accomplish things, and to some extent that goal observation being able to show that it's a patient's goal or if it's a clinician goal like that, or a shared goal. I think that gets to a little bit the question of, is the person wanting to have that driving the need.
Thank you.
Thank you, Lisa. All right, so I know we're at time. I'm doing a time check. I'm going to hand it over now to Lynette to spend a few minutes, the next few minutes, just going through our changes in our schedule. And then I will also then share the Confluence page. So Lynette, handing it to you.
Yes, thank you, Evelyn. And if everyone can check their devices and make sure they're on mute, we would appreciate it. Thank you all. First, we want to acknowledge that our timeline has been aggressive, and we have asked all of you to engage with us and keep up with the deliverables, and we sincerely appreciate you trying to run as fast as we have been. And as we said from the beginning, the timeline was never set in stone, fortunately, so we have the flexibility to be able to adjust it based on the collaborative needs, and we are going to adjust it. So we have decided to move our weekly Thursday meetings to bi-weekly meetings starting today. So we will not meet next week, but our next public meeting will take place on August 1st, which is 2 weeks from now. Next slide, please. And with that schedule, we have updated the week by week.
Oh, Lynette, sorry. Do you want to talk about the end? Yeah, missed the other point.
Oh, yeah, I'm skipping ahead here. I'm so sorry. I'm one of those kids who works ahead. Okay, do you want me to show the Confluence screen or do you want to show it? And I'll talk about...
yeah, okay. I'll show it after. If you just want to go through the main bullets.
Yes, okay, good. Yeah, we have extended the end-to-end review period to July 19th, which is tomorrow, and hopefully most of you on this call got that email. And if you did not receive that email, make sure that you are registered for the project as a joined member. And we will appreciate any comments or feedback that we receive on that use case through tomorrow. And if you can't get it to us by tomorrow, because we know we're in the middle of the summer, it's vacation season, kids may be getting ready to go back to school, who knows, just email us and let us know. You can email me, Lynette.Elliott@emiadvisors.net, to give us a heads up. And then after that, we will be consolidating all of those comments and putting together a finalized use case document upon which you will vote, and committed members will be asked to vote between July 29th and August 2nd. And in this deck, we have put the link to the consensus process. This is also on the wiki. So you can see how that's done, how we will ask you to vote, and how to submit those votes. And then we will ask that all of you can submit. We changed the due date on the food insecurity data elements based on the updated timeline. So now that we've pushed everything out to biweekly, you have until August 30th to submit food insecurity data elements. And after today, hopefully you'll have a better sense of kind of what we're looking for and what direction we want to take these discussions. So again, the instructions for that are on the wiki, and we will send a follow-up email after this meeting. Okay, I think now we can talk about the week by week, and this is biweekly now. We're here on 7/18. Then on 8/1, we'll go through food insecurity data sets and start those discussions. And homework is now assigned on a rolling basis. Basically, you'll be doing the same homework every time, with the exception of the use case consensus voting that's scheduled, like I said, from July 29 to August 2nd. And your homework will be to review the master list of data elements and to submit food insecurity data elements that your organization uses. And then next slide, please. Assuming we have rolling data element submissions through the end of the month of August, and hopefully not everyone will wait until August 30th to make your submissions, we hope to begin our end-to-end review of the food insecurity data sets by September 16th. And you'll see that, in the green there on 9/12, we will internally begin that review, that end-to-end review, consolidating those. And then once we review and consolidate comments, we will publish the full data set for consensus voting at the beginning of October, on October 4th. So this new schedule now has us kicking off the housing instability domain on October 10th. So during the month of September, we will be encouraging all of you to begin submitting your housing instability data elements. You can also do that now if you would like, and we'll follow the same processes that we did for food insecurity. And then moving on to the next slide. This is what I was excited about earlier. We have set up a food insecurity domain Confluence wiki page where you will be able to find the master list. Okay, Evelyn's going to share while I talk. We will be posting the master list following each meeting, and we will let you know in the email that it has been posted, and we will link directly to it. But we will also, as data submissions are adjudicated, we will also post those on the wiki so that the submitters and the community can see how those were consolidated in, whether they were duplicates, whether they were accepted, all of the criteria that Linda showed you. You'll be able to see for each data element or data element concept that was each line item that was submitted, there will be a response and a disposition assigned. And anything that gets rolled into the master list, you'll be able to crosswalk that to the master list. And Evelyn, if you're sharing your screen, we don't see it.
That's what I figured. Let me see.
Yeah, you have to pull it over from your other monitor. Yeah.
Okay.
And I think somebody needs to mute their phone, please. We hear phones ringing in the background. So if you heard a phone ringing, please mute your own phone. All right, this is the...
Allow me. Let me,
Okay.
all right.
Sorry. And I'll talk over it. I apologize because I'm trying to wrap it up and let you all go on time. This is the Food Insecurity Domain page. Again, we will send you a link to it directly. In the hierarchy of the wiki space, it lives under the Gravity Project Workgroup. So you'll see over on the left-hand side, you'll see Gravity Project Home, Gravity Project Workgroup, and then under that is the Food Insecurity Domain. So if you get lost, you can always go over to the navs and find it again. And again, we'll send you links. But you'll see on here where we'll post the food insecurity master list, and we'll post food insecurity adjudicated data element submissions. And then we'll also post some interesting statistics on what we've received so far, what's been worked on, what total data element concepts, so that you'll have an idea of the volume of things that you will be asked to review. And at this point, I think we can open up for questions before we show that very last slide, Evelyn.
Yes, in our home archive. Yep, I think that's it. So let me stop sharing this and go back.
And while she does that, your next steps will be to submit your use case end-to-end review comments before the end of tomorrow. Submit data elements by domain if you have any food insecurity, housing, or transportation data elements. And we will be asking you to vote July 29th through August 2nd. So keep an eye peeled for that email with those instructions. And are there any questions?
Yep, you should all be unmuted so you can raise your questions. I do want to acknowledge some questions here. Lisa's been answering them. Jane Miller. So as with LOINC, SNOMED is happy to work. Thank you, Jane. So SNOMED is happy to work on any requirements for content alongside our current Workday Academy. Don was asking me whether we have Epic, which vendors. So we do have a variety of vendors. I do want to acknowledge we do want to see who is on our, for those curious who's participating in our initiative, who signed up either as a committed member or other interested party, the names are published on our website. So they're on the beginning slide here. So just on our website, and forgive me as I scroll through here, we always start our meetings acknowledging, if you want to check if you've already signed up, we have a direct link where you can get a sense of who are the different stakeholders involved. And if you feel there should be others that are not included here, we also welcome that, because that's sort of word of mouth, that where are there stakeholder groups that should be involved in this project and not participating. Any questions? I'm hearing some background noise. Again, if you're not speaking, please keep yourself on mute. We open it up for questions. We're at time, but want to make sure you all have an opportunity to ask your questions or comments. No? All right. Well, then, oh, is that a question? Okay, well, we're at time, everyone. Thank you so much. So I hope you've got an extra week now in between meetings. We really are doing this because we want your input. So I think emphasizing very much what Sarah, Donna said, and then Linda walked through is that, and Lynette walked through, is that our schedule has been revised because we really want to incorporate multi-stakeholder input. So even if you look at the master list and you already see your data concepts that you're using in your setting, please still submit them. We are tracking duplicates. That gives us a sense which one of these are mature concepts, even if they are missing a code. But if you are documenting things across those 4 activities, still submit them even if you already see them on the list. So with that, thank you very much, everyone. We wish you a good weekend, and we will talk to you all in 2 weeks. But again, still continue submitting your data elements. We appreciate it. Have a good afternoon.
Thank you.